The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Kathy from the Office of Developmental Disabilities Program. If you can hear me, can you please use the hand raise button? All right. I just want to say it again. If you can hear me, can you please use the hand raise button? Thank you all. And now I'm going to give Lilia the floor. Lilia?
Thank you, Kathy. Welcome, everybody. We will go ahead and get started here in a minute. It looks like we still have several people logging on, so I'm just going to take a quick, maybe 30 seconds, and then we'll start going. Okay. First, I'll start by thanking everyone for joining us today. We've had several various webinars over the course of the last several weeks, most of them focused on specific groups of individuals, providers, case management entities, advocates, et cetera, et cetera. So we wanted the opportunity to bring everyone together and share just an overall update and hear from you toward the end with questions you may have about things that are happening. And with that, I just want to do a quick reminder to everyone who's on. This is a public forum and a public format, and so if you have questions specific to an individual or yourself or someone served in our system, I'd ask just to be careful that when you ask those questions not to share any confidential information. We can also take questions that we get that might have to do with individual situations and connect back with you at the after this is over. So just something to keep in mind as you're logging on and thinking about things you may want to ask us. My name is Lilia Tenenty. I'm the director for the Intellectual and Developmental Disability Program, or as many of you may know it, the Office of Developmental Disability Services in the Department of Human Services. We're the state agency ultimately responsible for services to about 30,000 children and adults across Oregon who experience intellectual or developmental disabilities. We work through a number of partners. We work through community developmental disability programs at the county level throughout the state, and we also work through brokerages to provide important services and case management type supports to individuals, adults who receive in-home services. Then of course we have a huge network of provider agencies, providers, independent providers, personal support workers, behavioral professional consultants, group home agencies, foster care providers, et cetera, et cetera. So a large community of people who are involved in the lives of individuals with intellectual and developmental disabilities throughout the state of Oregon. And this presentation ultimately is an overview that should include information for everyone, no matter how you come to the discussion, no matter what your role is or how you're coming into the discussion. So again, thank you for joining us, and we will go ahead and get going. I will give everyone the heads up that I am presenting and driving the slideshow, so we wouldn't have to do that thing where somebody says, turn the slide in the middle of the presentation, but that may mean I get a little bit distracted. So I'm going to try to stay focused on the presentation and on the information we're sharing. So I'll start by talking about the high-level priorities that the Office of Developmental Disabilities Services has really organized around and focused on since the beginning of this pandemic. Primary in everything we have been working on and thinking about and developing policy around is keeping people with intellectual and developmental disabilities safe and healthy during this time. To do that, we are focusing not only on policies and procedures that focus on safety and health, but also by doing what we can to support families and those providing services to people with intellectual and developmental disabilities, obviously in an effort to also, through that, support the people with intellectual and developmental disabilities themselves. This has been a significant effort. We have, in many ways within ODDS, shifted all of our work in this direction while we work to navigate the environment that is evolving and changing every day. I just got information right before we started that I think there's a governor's press conference happening right now where new information is going to be shared. And unfortunately, I will say right now, I don't know what that information is, so I won't be able to talk about it. But that just gives you a sense of how quickly things are moving and how we, like everyone else, are getting information through, news releases and media outlets and communications that we might get through both the governor's office and DHS leadership. So we're all pretty much operating in real time, just like everyone else, and doing everything we can to move quickly on the information we get in that time frame. One of the things that I wanted to highlight and talk about in this webinar is the fact that we have been doing a lot of reading, gathering information, trying to understand the impact and implication of COVID-19 and this virus on and with people with intellectual and developmental disabilities. And what we have seen ultimately as a result of that information gathering is that we have data that has come out of New York, from New York, different resources in New York. We've also seen studies that have come out of public health entities and different groups that indicate that people with intellectual and developmental disabilities are at a higher risk of adverse outcomes if they contract the virus. That means that people with intellectual and developmental disabilities are a higher risk of developing pneumonia and other complications that may result in serious illness and or even death. So we've been thinking about that. That has been at the forefront of our minds as we've moved forward in looking at the policies and procedures that we need to put in place to help guide our providers and our case management entities through this difficult time. One of the things we wanted to show you today to make sure everybody is aware of is we have a website that has been put up. It was put up in early March, where we are keeping and posting on a nearly daily basis new guidance and information that is coming out from the Office of Developmental Disability Services. I'm going to click here and hope it operates properly and takes me to the website. Fingers crossed. Yay, technology. Okay, here we go. Hopefully everybody can see the website right now. This is the website. If you don't have time to quickly jot down that big long web address, I would encourage you to go to your favorite search engine and type in Oregon ODDS COVID-19 information, and it should take you right here. If you do that, you can obviously subscribe to receive updates. So when we post something new, you'll get an email telling you we've posted something new. Right at the top of the page, we include links to other resources that may be of interest and important for people who are connected to ODDS to be aware of. We have the Oregon Health Authority's COVID-19 page and the 211 information page for COVID-19. We also have our link here on information for information about what we're seeing with people who have been confirmed or diagnosed in residential settings. And I'll talk about that a little bit later too in the webinar. The thing to look at here, and there's a lot on here, and I know it can be completely overwhelming. It's overwhelming for me sometimes when I go on, is that if it's helpful, if you want to know the different types of policies were released and what transmittals are tied to those, you can go to either of those documents. And then we break down in segments the sections of the guidance that we've issued. This particular list of guidance and all the pages associated for case management entities. We have general resources, FAQs, and then I also wanted to be sure that individuals and families know that we have general resources here and information. This is for all of the director's messages and all the various languages and different information that we put out that's specifically intended to help individuals and families. You can access it on this website as well. So if you haven't had a chance to look at that website, we encourage you to do so. And let me see if I can get back to sharing my screen. Woohoo, okay, there we go. So as I said, on that website, you'll see a number of resources available for individuals, families, case managers, and providers. Some examples that I wanted to share of the guidance that we've done and of information that is available on that website and through that website for individuals and families. We have a medical rights fact sheet, which is very important. That is something that we developed in response to some situations that we became aware of where potentially a person with an intellectual or developmental disability was not being able to access the types of treatment that for COVID-19 that people without disabilities are able to access. And so I know a lot of information on this topic has come out from Disability Rights Oregon. We also have the Oregon Health Authority's non-discrimination treatment guidance, which is important. But more importantly, too, just in a clear and straightforward format, we've developed a medical rights fact sheet to help individuals and families know that, you know, what their rights are in the context of medical care. Also, it talks about, and we have other guidance on this, the kinds of discussions that if a person with an intellectual and developmental disability and their family and their team are thinking ahead and planning ahead for the possibility that a person might need to go into a hospital as a result of COVID-19, just some discussions to have, resources to be made available, and just plans to make before that might occur. And we're encouraging everyone to consider that. We've talked to our CDPs and brokerages about talking with individuals and having those kinds of discussions right now, because planning ahead in the event that that might need to occur is going to be really important in the context of this particular pandemic and medical condition. The other thing that we have on our website, which has been very popular, and you can kind of see a screenshot of it here, is one of our Powtoons. We did a couple of Powtoons for anyone, really. I think they do a nice job for everybody of explaining COVID-19 and the reasons, the precautions like hand washing and social distancing are really important. We also did one specific to Oregon's stay home and stay safe order. So that's available as well. If you've got people where sharing that information through the format of a Powtoon might be helpful, those are on our website as well, and we encourage you to go to those and use those. We also, in the effort to try to expand supports and help families during this time, because we know right now for everyone, and in fact, including myself, we have children who are not in school and are home, and we know that especially for families of children with disabilities that may put some extra stresses on the situation. So we have expanded our family support program beyond what we normally approve in that context to provide supports for children that are tied to the child's disability, will help during this time, and ultimately also are, clearly connected to the COVID-19 pandemic and the stay home, stay safe executive order. So information on that is also available on our website. And if you're a family member listening of a child, you can talk to your services coordinator about more information on that. Okay. Whew. I'm not going to run. That was funny. I'm not going to run the pouching for you. You'll have to go to the website for that. Other information that is on the website that's available for our case management entities, CDDPs and brokerages. We had them early on go through and look at the people that they support who may be at higher risk, and really make sure that the backup plans and the ISP for those individuals cover the types of supports and resources that people will need in case they need to implement the backup plan. We extended ISP end dates and needs assessment expiration dates. We have not changed the frequency of our monitoring expectations for case managers. And in fact, I would say we know and are hearing that many of our case management entities are doing more monitoring right now than they usually do. The difference is that monitoring is done in a different way. Video conferencing, phone check-ins. I know some service coordinators that are supporting people by going and visiting them and standing outside a window and having a conversation with them through the window to ensure that they're safe. We've had in some of the stories that we've collected for just creative ideas that is also on the website that people have done. We have assessors, for example, that are completing an assessment while someone sits on a porch and they stay in the driveway and have the conversation over the phone. So a lot of creative, unique things going on, although tied back to the monitoring expectations and all to ensure that during this time we're staying connected with people that we support through our system. For provider agencies, our focus has been on ensuring that to the extent possible, they stay intact and sustainable to the extent possible so that they can support their workers and their workforce during this time. We issued contingency funding for employment and day service providers that was 30 days. That actually is the 30-day time period is wrapping up. So I know a big question that everyone has is whether or not we're going to continue it. We're looking at that question right now, and we'll get information out very soon on that. One of the challenges we have is if you jump down to the third bullet, we're requesting approval from CMS for the retainer payments that go beyond the initial 30-day period. And thus far, we haven't gotten movement from CMS on that. And just so everybody knows, that's not just unique to Oregon. I think just on some recent information that came to us, it appears that that is a national issue that CMS so far doesn't appear to have moved on agreeing to any kind of payment beyond 30 days for any state or any entity during this time. I think there's also some connection potentially for CMS between that and the funding that was available through the Family First Corona Relief Act. I will say for providers who may be on this webinar, just in the last couple of days, we've gotten requests to submit directly to CMS data about all of our provider entities, our provider agency entities, and we've been coordinating with OHA on that. And all of our data has been submitted to them as of, I think, yesterday. And OHA is now pulling it together to submit back up to HHS. We don't know what will happen with that, but we do understand it somehow ties to funding that's available in the FFCRA legislation that initially was geared primarily toward Medicare providers, but also now will include to some extent Medicaid providers. And again, I have no information beyond we've been asked for that data and we've shared it. I don't know, I have no idea what ultimately that funding might look like or how it might occur. But I did want to let our providers know, because I saw a couple emails come in today asking about it, that we did get that request and we have worked on it and we have sent it up through the chains that we were asked to send it through. Personal protective equipment has been a focus of a lot of our efforts, a lot of our work, a lot of our discussions for obvious, very important reasons. Initially, I just wanted to go through here on where we're looking, or where we are saying the guidance we've given on where to get PPE for DSPs that work with agencies or foster homes, adult foster homes, or child foster homes for that matter. The guidance we have is to work with your local public health authority to get PPE, or your emergency operations center. Those two things, emergency operations centers are now set up. I think they're all county based, and they are working with the local public health authority, so that if through your normal channels of ordering you're not able to get the type and the quantity of PPE that you need, those are avenues to work through. For personal support workers, we've set up a process through the Oregon Home Care Commission where in the vast majority of the parts of the state, those requests will come in through there, and personal support workers in our system will be able to work through the local APD office and either have the masks and gloves mailed to them or pick them up depending on the window of pickup times available. So that is the process for those workers. For individuals in service who want masks, protective masks or gloves for themselves, we're encouraging you to connect with your case manager. There's a process that we've made available where those items can be ordered by the CDDP or brokerage for individuals. So that's something that is available, and we would encourage you to use that resource. On the right, is it right, left, right? Yes, on the right here, you'll see a graphic that we'll be sending out shortly that shows the different type of face coverings and when they should be used and when they can be used. You'll see N95 is on here. That is to be used when we have someone who is suspected or positive for COVID-19. I will say that at this point, we have been following OHA guidance in terms of masks and have been talking about how they're recommended. We are looking to shift that from recommended to required for our DSP provider agency staff. We want to do that thoughtfully. We want to give plenty of notice so that agencies know that this will be coming. We're asking in that shift that if you've tried to get cloth face masks or surgical masks and can't access them, that be documented. Again, this is all from the standpoint of ensuring, to the extent possible, the health and safety of people with intellectual and developmental disabilities. Given what we know about the increased possibility of adverse outcomes, we want to just look at our guidance and make sure that it is consistent with, I would say, a high level of expectation around safety for these workers and for the people who support them. So that information will be coming out shortly, but I wanted to draw everybody's attention to it. This is our primary avenues for PPE at this point. And if you are a provider who has someone in your services who is suspected or has been confirmed, you would work with the medical professional and then your local emergency response center or local public health entity to get the access to the higher level of PPE that's needed, like the N95 masks and potentially face shields and other things. The current situation, where we are now, this is like, it's been a couple of months now, which is all a blur, I think, for me and probably for most people. We acted quickly to take the steps we needed to take to keep people safe. In addition to the visitor restrictions and other precautions, we also, early on in this process, closed our large congregate day programs and large congregate employment type settings, employment path settings. I will say that Oregon is fortunate in that we moved away from large congregate residential settings many years ago. And if you look at advocacy and national news around other DD service systems, definitely those states that still have the large institutional settings are struggling, quite frankly, with the virus going through those settings and causing a great deal of challenge and ultimately harm to people and staff who live and work in those settings. So we're fortunate that we don't have that here on our residential side, but we definitely did have some larger congregate day settings still going. And so one of our early actions was to ask those providers not to provide services anymore. And to their credit, they all understood the importance of that and moved in that direction very quickly. I will say, as I mentioned earlier, we have no more information about how reopening will occur than you do. We know the governor's office has put together a framework for reopening with the intent that they are going to gather input on it, and that the process will be gradual, and that from our perspective, we're going to want to support and push guidance related to the reopening process that ensures that individuals with intellectual and developmental disabilities and their providers continue to take appropriate precautions as things open up slowly, but more broadly, and depending on the business sector or the part of the state, or however that process is going to play out. I want to stress that because I know it's going to be a big part of the discussion as we go forward around what does reopening look like. And so from our perspective, we don't have any more information on when or how than anyone else at this point. However, with that, as soon as we do know, we'll be looking at how we issue guidance and support the need for people who may be at higher risk for adverse outcomes to continue to take the precautions they need to take as that occurs. I mentioned earlier on the website, we have a report that shows, we update weekly on the website, how many people and how many staff in our system have tested positive. And I think I haven't tested this link, so we'll see what it does. We can all find out together. It should go there. Oh, no. Oh, I don't. Okay, I'm going to be brave. Everybody hold your breath for me. Okay, here we go. This is a document that we update on a weekly basis that talks about the number of people we are aware of that have tested positive. You'll see in this document for this week, we have one individual in a foster home. As far as provider staff, we have one person in a child foster home, 4 staff in an adult foster home. Then we go down to group homes, 3 individuals in a group home and 5 staff. And then for in-home services, we added that just recently. We have 5 individuals and 4 provider staff. We are not providing detailed information beyond this at this point because, again, we want to protect the confidentiality of the individuals involved in these situations. We have had media requests to tell us by county, and we can provide that based on, looking at the number of people in a county and whether or not it meets a certain threshold. So we are updating that on a weekly basis. However, we are not providing, a specific level of detail. Again, I think in the context of our system in Oregon, as compared to maybe the APD system, we don't have the large congregate settings. And so when we're providing information, even if it's for a group home or a foster care home, that's a small home in a neighborhood as opposed to a large nursing facility or some other setting. So I think for us, our threshold of the information we provide is a little bit different. moving on, something else I wanted to bring your attention to and say, please help us with this. We are seeing in our system, as well as across all of the systems population served through DHS, a decrease in the reports of abuse and potential reports of abuse and neglect. I wanted to stress to everyone that abuse investigations and protective services are still required. Our format or our modality or the way we are doing abuse investigations has shifted a little bit as a result of not wanting to go out and do a lot of face-to-face interviews, but those interviews and those investigations are continuing. It's everybody's job to report suspected abuse or neglect, and if you're a provider or provider staff, you are a mandatory reporter, and so we do look to that and ask you to continue reporting when you suspect abuse and neglect. And then we include the SAFE hotline for you, just in case that information isn't handy for you otherwise. So we are continuing to do abuse investigations and provide protective services, and for those providers that continue to support individuals during this time, we're really looking to you to continue to report as we would expect anyone to during other times. And then again, going back to the monitoring that's occurring with our CDDPs and brokerages, that is happening just to ensure people are safe, but also to help us kind of keep an eye on what's happening with individuals in various settings. So thank you for thinking about that. And if you leave this with at least one thought for the day, it's that, share with everyone you're aware of that we need to continue to report when we think there's suspected allegations of abuse and neglect. Looking ahead, we will continue to issue guidance to ensure people with intellectual and developmental disabilities are safe and healthy. That will continue to be our guiding principle as we move forward in this process. Something that I think we're seeing, and I expect others are seeing it across our system as well, is that we've been able to do things because of this particular crisis that we didn't think were possible in the past. We've been able to move quickly in a lot of ways. We've been agile and are allowing things that in the past we were not allowed to allow. I guess that's for CMS and other reasons. And so our hope is that we can learn from this experience, and it is highly unlikely that our system or anything else, frankly, will go back to exactly the way things were before. And so what we're hopeful for is that we can take those positive things that have occurred as a result of this and build that back into whatever we move forward with on a more permanent basis. And so we'll see what that looks like as we go forward. But I know we're learning a lot about supporting people remotely. We're learning a lot about how we can use technology for different types of approvals. I think the issue will be, continuing to get that approval and shoring up our systems to ensure that every system we use is HIPAA compliant, because while HHS is not strongly enforcing HIPAA compliance right now, they will definitely be going back to that. And so that is something we'll have to consider as we look at what we're able to continue on in the future. And when I say HHS, I mean Health and Human Services. That's the federal agency that our Centers for Medicaid and Medicare Services sits under. And I apologize for using that acronym. Let's see. Here we also want to keep stakeholders informed about budget. I think, like everyone else who is reading things that are publicly available and publicly known, the state is expecting a significant drop in revenue. The formal revenue forecast is out May 20th. In the meantime, every state agency has been asked to look at what reductions they might be able to make for the last year of this biennia. So I'm just saying that that's something we know is that we're looking at. This is what I like to refer to as a budget exercise. We don't know what the future holds with this, but we do know that there is a high expectation that revenues will be down, and that the legislature and other, who ultimately guides our budget process and the governor's office will be looking at that as we go forward. So as we get more information on what is occurring with that, we will be sharing it. At this point, I think we've made it through everything that has been prepared, and we've got some time for questions. Again, just a nice reminder that if you have a question for about a particular individual or a particular situation, if you're going to type it into the question box, that you not include any confidential information. So with that, Angela, are you on and unmuted?
I am here.
Okay.
Yes, and we have quite a few questions that have come in. I'm going to go in order. And if for some reason, I just want to let everyone know, if we don't get to your questions, we will be logging all of these questions, and anything we don't get to, we will post with an FAQ along with this presentation. This webinar will also be posted on the ODDS COVID webpage. So the first question is, how will the governor's requested 8.5% cut affect the ODDS budget in light of the 6.2% FMAP increase? Are we still looking at deep cuts, and how much?
Thank you. That's a good question. What we have been tasked with at this point is to look at our budget without considering that additional federal match. And the reason for that is that when that federal match comes back into the state, it doesn't directly go to us unless it's appropriated by the legislature. So it should help offset some general fund costs, but we'll have to see for the entire state budget ultimately how that's allocated and what that looks like. So at this point, when we're asked what we've been asked to look at, part of what was directed was that we not consider that particular funding because everybody knows it's there, and ultimately through the regular legislatively appropriated budget process, that's how that money will be appropriated.
Okay, great. The next question is, can we request regulatory relief in an emergency request of CMS, i.e. reach out to case managers for the most onerous burdens on their time and seek streamlining in a CMS emergency waiver modification request? Can we hold a stakeholder meeting to help craft a future waiver modification request?
That was a lot of questions all in one. So we have done a lot already to streamline processes as a result of this. And when I talk about things that potentially we pick up and go forward with in the future, I think some of the things we've learned about how things can work in a more streamlined fashion with, electronic sign off and things like that are the types of things that we would want to see how we can continue in the future. Yes, that would require a discussion with CMS. It would also require actually a discussion with our own Department of Justice, which is an Oregon Health Authority, which are other layers to our process. But yes, that's the kind of thing we're talking about. And we have engaged with case management entities, CDPs, and brokerages many times on the question of what can be streamlined. And we have that information, and prior to this, we had taken a lot of that guidance and implemented it. There were a lot of things we couldn't implement for any number of reasons. I think in the context of streamlining, one of the biggest challenges our system has is that we do not have a statewide case management system, IT system. And so whenever we need data, even in the context of this exercise, or not exercise, even in the context of this crisis around COVID-19, we had to ask our case management entities to send us data on high-risk individuals, not through an IT infrastructure system, but in Excel spreadsheets, because we have no IT case management system. And so that, for example, is something that would help us streamline across the board if we could get movement on that. So absolutely, we're taking everything we're learning about streamlining and improving things, and absolutely, we will continue to have stakeholder discussions about it.
Great. Next question is involving training. What steps can I take to get the trainings done for the 90-day trainings? And I'm not sure what that refers to exactly.
I unfortunately am not sure either. Acacia or Anna, any ideas what that might, does this help? Do you have something to add on that?
So this is Acacia, and there are lots of different requirements around core competencies, as well as requirements for different services such as employment or discovery. Right now, for provider organizations, including employment providers and residential providers, as well as case management entities, we are offering a free 3-month subscription to Open Future Learning, which is one avenue for some new trainings. However, there's also a requirement for core competency trainings, which are available for free online in our iLearn system. Additionally, we do have some expedited, is the word I'll use, training requirements in order for residential and foster care providers to be able to onboard and have staff working quickly due to this crisis. So that's also outlined in policy. And when we post this FAQ, we will link to all of those opportunities and policies as well.
Great, thank you. The next question is, how will the stimulus check affect an individual's Social Security limit?
So guidance has come out from APD and CMS and other places indicating that the stimulus checks should not count against income requirements as long as the funding is spent, I think, over the course of the next year. And so Acacia, can you share the details on that and the ABLE account information?
Yeah, so that's another policy that we will gladly link to. Some national organizations actually have put out some really great fact sheets on this that you can find on our COVID webpage. However, the best recommendation I think I could make right now for any concerns around being over income due to the CARES Act or potentially filing unemployment would be to connect with a benefits counselor. You can do that by talking to your case manager. Or if you are a provider helping a person make a referral to Work Incentives Network or Disability Rights Oregon, all have benefits counselors. And so does ODDS on the waiver. And those are services that can be done remotely. So you can do that through Skype or phone in order to get that information. And then the other option, as Lilia mentioned, is if you are an individual who's concerned about potentially being over income or not spending money the way you normally would, it might be a good time to consider opening an ABLE account, which is a program that allows individuals who qualify to save, I believe, up to $100,000 based on their need for that savings. So we do have information about ABLE accounts and how to open those ABLE accounts on our website, and a benefits counselor could also assist with that.
Great. Next questions. If an individual is furloughed during the pandemic period and not getting an income, including unemployment, can the EPD payment be temporarily adjusted?
So I'm going to say I'm not sure exactly how to answer that because I think that is not a question that ties to ODDS. Acacia, EPD payment, are you?
Yeah, I think that's about the employed people with disabilities.
Okay, thank you.
Yeah, that helps. It helps for individuals whose primary Medicaid may come through Medicare, right? So that is something that we hadn't had much conversation with, but I would be happy to engage Aging and People with Disabilities, who administers that program, to get some more information.
Thank you.
Great, thank you. Okay, next one. Parent here of a kiddo. Do you plan to have any further transmittals to the various counties regarding the family support $600 funds? There are many, many families frustrated with the backlog of purchasing / approving / acknowledging these requests, specifically in Multnomah County, who is only making 30 purchases per day due to an extremely antiquated system and lack of personnel handling these purchases. Can you help them get the lead out and realize that this is supposed to be less red tape than usual?
I assume that means get the lead out, not get the lead out. Thank you for letting us know that we're having challenges in Multnomah County. I know that we've gotten a lot of feedback about differences in how potentially the guidance that we put out was being interpreted. We've done more to try to clarify that. We've had FAQs, we've had weekly discussions with case management entities where this has been an issue that has come up and we've addressed. We will make a note to connect with Multnomah County and see if there's something we can do to help them speed the process of moving on these requests.
Great. I think this might be an Acacia question next. Data for the EOS, that's Employment Outcome Survey, requested information for March 2020. I'm not sure about other providers, but we were severely impacted in service delivery halfway through March. As such, the data is not going to reflect an average month of service delivery. Is this intentional to gauge the COVID impact?
Yeah, thanks, Angela. The request for data into EOS is it's our regularly scheduled time in March to gather that data. We are absolutely aware that business changed dramatically due to COVID in March, and that is going to impact the data that we receive. Yes, part of what we're trying to do is gauge the impact of COVID, but also we do use our EOS data for Lane v. Brown, and it is important for us to continue that. So we appreciate providers responding. It will be very helpful information, but we also do acknowledge that there will be substantial differences between this round and previous and hopefully future rounds of EOS data.
Okay, the next question is N95 better used with a client during cancer treatment visit for infusion?
So in a question like that, I would consult with the person's medical professional.
Okay, the next one. Can you direct us to anyone anyone completing the fit testing for the N95 masks, as we are not able to get the kits or find someone to complete the fit testing? And if the masks are required, we are required to get these done on employees for wearing these.
Yeah, we've done a lot of information gathering on the fit test requirements. I don't know that we have information on specific entities that do it. I would suggest in that instance to either go through OSHA and see what information they have available, or through your local emergency operations center.
This is a related question. Can you expand on the OSHA requirement on the fit test? Are providers able to just ensure to use and have surgical and cloth masks to avoid that?
So the OSHA guidance is the OSHA guidance. We don't have, you know, that is their guidance. We have information that has been shared with providers and others around what their expectations are around fit testing. If I were to summarize it, it is only in the instance fit testing is only required when an N95 mask is actually required to be used. So that is only in the instance of a individual who's suspected or confirmed to have COVID-19, which, you know, definitely narrows down the total number of N95s and fit testing that needs to occur. I would encourage you to connect with your OSHA contact if you need more information, or if you're looking for direction in terms of what their expectations are around fit testing.
Okay, the next question is, at this time, are employment services and vocational services still closed?
Keisha, do you want to take that?
Sure. So any congregate or group setting is not operating right now due to the stay-at-home order. But we do still have individuals who are working. So they are continuing to get an employment service such as job coaching. It may be remote, it may be a phone call or a Skype or a FaceTime check-in. So that service is still continuing. We do also still have some small group services that are working or operating in hospitals or helping to produce required medical PPE. And so those services are still operating as well, just ensuring that there's social distancing, helping individuals stay at least 6 feet apart. So there are some services that are continuing to operate if they're an essential service. However, many of the group services are not going on at this time and have not reopened.
Okay, the next question is, will individual Medicare foster homes be getting an increase on rates as well?
Medicare, I assume that's
I think they just meant foster, IDD foster homes.
okay, thank you. So I assume this relates to adult foster homes. No, at this time, there is not any plan to do an increased rate for adult foster homes.
The next question is, hospital staff are turning away DSPs from entering to support individuals. Is this okay?
So OHA has issued new visitation guidance that if a person with a disability needs support for decision making or because they're, others might be at risk if they don't have the support while they're in the hospital. Hospitals should be, the guidance from OHA is that those visitors should be allowed to go in. Beyond the guidance though, if that is occurring and if we think that it is, risking a person's health care or ability to, receive appropriate treatment, the avenue that I would recommend to people at this point is working through the OHA Ombudsman's office to try to work with the hospital to get this addressed. ODDS has been involved in some discussions with hospitals through the individual or their provider. However, we don't, that's how we talk, that's the avenue we use to talk to hospitals. Hospitals are not under our jurisdiction, I guess is how I would describe it, statutory or regulatory or otherwise. So I would go to at this point, what we're being told by OHA as the way to try to help address this is go to the OHA Ombudsman's office, and we can post that information for how to contact them publicly if that will help.
Next question is, are you still planning on the ONA cutting 30% with the new service levels this summer?
So the ONA was never intended to cut 30% of anybody's service levels. So I'm just going to correct that. That is not what the ONA is for, and that's not why we're using the ONA. We are pausing on right now implementation of the Compass project, which is how which was moving into using the Oregon Needs Assessment to group people both for rates and for in-home hours. We are looking at when we can pick that work up again, but for right now, everything that we would have needed to do to move into the new rate structures, for example, as we had planned for January, I think of next year, is just, we haven't been able to do that work because we've been focused on this. And just to go back to the comments about using the ONA to cut, we actually, as a result of this, will have people who get authorized for more hours of support. We'll have people who get authorized for about the same hours of support. And then of course, yes, we will have people who are authorized for less, but I just want to clarify that for whoever wrote that question. Go ahead, Angela.
About the PPE, how do we get those again for PSWs?
We issued a transmittal through the Oregon Home Care Commission issued a transmittal, and I think we sent it out to, basically it is a link, if I understand it, where there's a form to fill out. We can post that information as well, but basically it's a form where you fill out indicating what you need. That goes to the Home Care Commission. They connect you with the APD office to work out the details of how you will get the mask surplus.
For DSA providers, what might a gradual reopening look like?
I think that's an excellent question. I don't know that we have any specific information on that right now, because I don't know how whatever we do is going to have to tie in and should tie into the broader statewide reopening plan, and at this point I'm not sure where that fits in.
Could the ODDS COVID-19 positive case report be sent out to the field?
It's posted online to our website. That's how it's available.
Okay, next question. Are you still feeling positive about retainer payments given the fact that things seem to have stalled nationally on CMS approvals?
I am, wow, these are tough questions. I am hopeful that CMS will move forward with allowing states to do more than the first 30 days of retainer payments. What is happening right now, if I'm understanding all of the emails and things that we've gotten just, I would say, in the last couple of days, is there seems to be at CMS some level of, and it could be higher than CMS, I don't know, somewhere in the federal government, the fact that there was $1 billion in funding to support what was initially thought to be Medicare providers in the FFCRA Act, now including Medicaid providers. Now the federal government is going to take whatever proportion of that funding that's for Oregon and distribute it directly. That's part of what we've been asked to provide the federal government, is provider information for our agency providers so that it can be distributed. It is unknown, I want to say, before I get this, as we think about this, so folks know, we know very little about this ourselves. We don't know what percentage of funding will go to anyone. My guess is it's going to be proportional for states and proportional for providers in states. So I don't know what that means for our provider community. I think there's potentially some concern, if you will, that funding, as it's available from the federal government directly to providers, should quote unquote take the place of, or not be duplicative of, any contingency funding or retainer payments that are approved past 30 days. So I think the issue, I would have been more positive, I would say, on the future of retainer payments at the beginning of the week. Right now, I'm not really sure what that's going to look like. However, with that, I will say we know for Oregon that we need to do everything we can to support our provider community, and that may mean taking a risk and looking at what we can do for the next 30 days, whether we know for sure we're going to get CMS approval or not. So those are the kinds of things we're weighing right now as we look at how we go forward.
Okay, I know we're running close to be out of time again. Whatever questions we don't get to, and we won't get to all of these, we will post with an FAQ on the ODDS COVID webpage. Here's the next one. Need brokerage services for our daughter after moving out of residential setting in early March. No response yet. What are the timelines to get services started?
If that person, do we have a regular, on the last page, I think, I'm going to squint. Oh, I'm driving the PowerPoint. I apologize. That's me. Oh, and we don't have an email address here for people to send questions to. Angela, can you give my DD Director can you just say my DD Director, I can't remember if there's a dot in it or not, website for folks, email address for folks? Is it DD Director
Sorry, I was looking it up myself. Yes,
Okay.
so the email is dd.directorsohfa.state.or.us. And I will also put that into the comment box here.
Thank you. And I would encourage whoever's asking that question, if you could send us an email and give us a little bit more detail information on what the situation, and we can we can go to the brokerage or whomever involved at that point.
Okay, we have received some N95 masks from our county. If we were to have a positive case, is there a resource or someone who can help with fit testing? Oh, sorry, I just realized I think you already answered that question.
Yeah. Oh, OSHA.
Yes. What are some positives you foresee being implemented as a result of the challenges from COVID-19 moving forward?
Oh, good. That's a good question. I think we have moved quickly into the realm of remote communication, telecommunication with people, and just like anyone else, I think we have individuals who respond potentially to remote communication more effectively ultimately, or more engaged with it than they are with regular pick up the phone or text. So we've talked about remote supports continuously, but it's never been something that's been pushed to the forefront. I think this situation has pushed that discussion to the forefront for us. And if we can, going forward, work through the issues around HIPAA compliant access to technology for that, I think that's something that I would hope we don't fall all the way back on, but I hope instead we take what we've learned and what we've done thus far and move forward with. Other things relate to kind of streamlining approval processes for ISPs, and if you're served through brokerages, your provider contracts. If there's ways that we stalled out on things like electronic signature years ago because of concerns from our Department of Justice. We've pushed forward now in the context of this crisis and are doing things via electronic approval that we didn't think were possible before, and I'm hoping that's something we can not fall all the way back on, but pick up and continue forward with. I would say, we've heard a lot of really creative ideas that our DSPs and PSWs and other providers are doing with individuals to engage them in ways that maybe we haven't thought of before. I know an example that we've talked about a few times is a woman who wanted a career in, the fashion industry. Her team has gotten her hooked up with online fashion courses. We have individuals who were, scheduled to go to in-person classroom trainings on things like computer programming, and instead, as a result of this, have shifted to an online mode, and they're doing great. So I think the pieces of this that I hope we can pick up and move forward with in the appropriate HIPAA compliant and everything else that we have to do regulatory environment that we usually operate in, probably tie mostly to the streamlining of things as a result of the use of technology, and tie to using technology more effectively across our system. I would also say I hope that this situation helps us in our push forward to try to get movement on getting a statewide case management system for DD services. Good question.
Great, and I think that is a good place to wrap up. I want to make sure everyone knows we've logged all the questions we did not get to. We will be posting those with a frequently asked questions document on the ODDS COVID webpage, along with a recording of this webinar and the PowerPoint. So you can look for it there. Is there any last words, Lilia?
No, well, I said no and then I go into words. So thanks everyone again for participating. Please go check the website for updated information, and go forward and do the good work you do working with us to keep people safe. Thank you.